Well, welcome back to my listeners. Welcome back to the Depths of Healthcare podcast. I'm your host, Ben Iiames. Got a really exciting episode ahead for today. Got one of our friends on the podcast, James. James, why don't you introduce yourself, and then we can kind of delve into your business and what that looks like.
Yeah. So happy to be here. I'm James Marlin, and I am founder and CEO of a couple functional medicine clinics out in the West Texas area, Amarillo, Texas, and Lubbock, Texas.
And for the viewership, obviously, we'll connect links to what these clinics are. If they're in your area, then they can get connected with you. But how did you come up with these functional medicine clinics? What do they look like? What gave you the idea?
Yeah. So a little history on me. I have been in the medical field for about 26 years now. I come from orthopedic sales and surgical sales, and
Yeah.
about 15 years ago, I was diagnosed with a rare liver disease called PSC. And through that journey, I kind of had the business idea that I wanted a nurse to come to my house and give me an IV. I just had no idea what I wanted in it. And so I started looking at other alternative things out there. What other IV alternatives, and came upon IV vitamins, and, went and met with a physician who was doing it at the time and learned a lot more about it, and just decided that I wanted to put a business in motion. Because for me, whenever I was diagnosed, the liver specialist essentially said that most PSC patients live about 10 years once they're diagnosed. So for me, I was given kind of an expiration date, and I just was super unhealthy. It took 2 years to diagnose me. So I was depressed. I was taking pills. I was just in this bad cycle. And so
Yeah.
for me, when I had this idea and met with this physician, there was just a calling for me to try to educate people and get the word out of other ways to take care of yourself besides just what I knew, and that traditional wait until you get sick, then you go to the doctor and you get pills and all that. So we started as an IV vitamin hydration company. We started off in Lubbock, Texas. So we
Hmm.
started 9 years ago, a little over 9 years ago, with the goal of building into a clinic where people could come and get different treatments depending on their beliefs, budget, and diagnosis. And
Okay.
so through the years, we have just continued to add different modalities. And, you know, in our West Texas world, we're not always known for just the most forward thinking and open mindedness whenever it comes to medicine. We come from a lot of rub some dirt on it type mentality. So education has been very important for us to try to just hit home with what are benefits of having more of a prophylactic approach to your health
Mm,
instead of just waiting until you get sick.
yeah.
And so through the IV vitamins, like I said, we just continue to kind of build and grow. And now we have two separate locations where we have, mid levels in house where we do more of treating the body, not treating the symptom. So, we do different blood work, Cleveland Heart Labs, and micronutrient panels, and genetic
Mhm.
testing, and, all those things that are becoming more popular out there. That's more what we try to dive into uh,
Right.
the clinics.
They're not, it's like, from what I'm hearing, and correct me if I'm wrong, but it's kind of you're bordering on that naturopath, but you're respecting kind of the medical hemisphere, but you're also willing to try different therapies or modalities to see kind of what sticks in a sense.
That is correct. Yeah. I always jokingly tell people that, we take a little bit of hippie medicine and we take Western medicine and we try to meet in the middle somewhere,
I love it.
because I firmly stand behind Western medicine, and I definitely think there's a place for it. I just think that we can do, we can take control of our health in a different way, because now it's the education's out there to back a lot of what we've anecdotally seen. It's more of conversation, things like peptides and all of these other conversations now that are becoming more and more common, which I think is fantastic. So that is what we're doing, a little bit of that naturopathic type stuff, but really it's more just honing in on your body, not just taking a cookie cutter model. And, you know, a physician in a Western medicine world is sometimes forced to just have
Hmm.
limited time with a patient. So there's only so
Hmm.
much you can ask from a physician whenever you're dictated from insurance that you have 15 minutes with this patient. You can only find out so much information about somebody in that 15 minutes.
So do you open up, from what I'm hearing is your physicians or mid-levels like PAs or NPs that you're employing, are they able to have that extra time and really to get to know their patients and know how to be proactive in their healthcare versus reactive?
Yes, sir. So our practitioners basically have 30 minutes to an hour with a patient, depending on what they're coming to see us for. New patients, we typically take about 30 minutes just to kind of dive into what are their goals. Then once they do blood work with us, we carve out an hour to be able to go over the blood work extensively and really hone in on a program that's best
Right,
for them. Like I said, we
right.
try not to take that cookie cutter approach. We want to kind of talk it out with the patients and see what works for them. Once again, whether it's budget, beliefs, or diagnosis.
Yeah, yeah, yeah. That's really cool. I mean, and that's what you need from, I mean, from my standpoint, if, I mean, primary cares are getting scheduled every 15, 20, 30 minutes at most. And at that point, you're getting to, you want to fit in more patients per hour to get the reimbursement based off of it because money is driving healthcare now more than anything. But then we're losing contact with the actual person that we're taking care of.
Yeah. And to that point, I think what's different about at least our functional medicine clinic is that we give the providers more time with the patient. So on the business side, it doesn't always make business sense whenever we're talking about provider to patient time. But what I'm banking on is that that provider is going to educate the patient in other therapies that needs to be done to where that patient is a long term, for the lack of better terms, payoff for the business where we actually can keep the lights on from kind of keeping that patient involved.
Right.
And so it's improving the patient's quality of life. And then you're able to make money as a business to continue to expand other therapies. So the business doesn't
Interesting.
always make sense on the front end, but hopefully on the long run is where we kind of catch up.
So, yeah, and that's a good point. Probably initially you had, I mean, it was pretty thin margins or negative margins for the first few years or so until
Yeah.
you could actually build out different therapies, I'm assuming?
Well, for sure, what the patient's there for several months, because if we are providers sitting down and we're putting them on a supplement program and we're doing genetic testing and, some of these other things where it's a kind of a makeover on the front end, then we're able to make that up with some of the therapies that the patient is signing up for. Hopefully, if it takes a couple years, I'm in bigger trouble than what we realize. But it is a long game, I mean, because I'm a firm believer of trying to improve quality of life. Like I can use myself for example. I still have my disease; it still progresses, but I'm so much healthier today because I'm taking care of myself in a different way than what I ever even knew of, 15 years ago. So we always are very careful of how we educate patients of we're not saying that we're going to cure any diseases,
Sure.
but we can help improve quality of life through education and through some of these other therapies that you're doing, all just to take control of your own health. I get frustrated that we've grown up on this model that you need to invest in your wealth for long term, but what about investing in your health? Because if you don't
100%.
invest in your health, all the money that you've worked your ass off and it's gone, or I'm sorry, you're gone before you can actually
Enjoy anything.
enjoy it. So that's what I just wish we would really, and I think that the movement is happening where we're getting behind that a little bit more, but I think that that's still a roadblock a little bit with people to really invest in their
Totally.
health, not
Well,
just let's go to the doctor and get a pill.
I mean, like you said, we weren't raised on it. That wasn't the idea. It's, hey, do your things. Yeah, sure. Have a couple veggies here and there. Drink a lot of water. Don't drink too much alcohol. Exercise occasionally. Go on some walks, and you'll be fine. Right. But then different people have different motivations. If they get off of any trend, then usually it spikes in a really, really bad way. Then, I mean, look at the obesity epidemic that we have currently ongoing.
Yeah.
Right.
And I think one thing that I hope people continue to open their minds about is that just because insurance covers it does not mean that that's the end all be all. Some
Yeah.
of the things in the
100%.
functional medicine world are not covered by insurance company. In
Yeah.
fact, we do not take insurance at all at either of our clinics because most of what we do, insurances don't cover it. But I think we grew up on this mindset that if it's not FDA approved and if my insurance doesn't cover it, then it's not any good and I shouldn't do it. And so it's exciting to see more and more people getting behind that concept, or I should say, getting rid of that concept of thinking and opening their minds. But once again, I can just speak for kind of out here in West Texas. It's slowly picking up, but
Sure. It
it
takes
would
time.
definitely be good. Yeah.
It's a mentality shift, and you hope that, the younger generation is more malleable and flexible in their thought processes. And I mean, it comes to a fact of we're taught to invest, in your retirement and get the matching, whatever it is, like 4%, or, you know, invest in an IRA every month. And then in 40 years, you'll have enough to retire very comfortably. And it's like, okay, well, how about a gym membership for $60 a month? And people are like, oh, whoa, 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 that's way too expensive. And it's like, okay, well, what if you invested that and actually put it to use? Maybe you're actually able to enjoy the body that you're given for the next 30 years if you go regularly. But what I'm hearing you say is that your clinic is kind of stepping into that void of healthcare, honestly, overall, just to be able to provide that service, or if people want that opportunity, right?
And
And
I think
did I
just
hear that you've actually, I mean, you're past your expiration date, right?
I'm past my expiration date by
Come
a
on,
few years now. Yeah.
start with that. Maybe people would listen.
Yeah, no, absolutely. Well, and I think, I think that's what's exciting about, you've got big name functional medicine guys out there, people like Gary Brecka who are starting or have been having these conversations, but it's becoming more common. So more and more people are coming to the clinic saying, okay, I saw this on social media. Gary Brecka talked about XYZ or, some of these other people. And so it's exciting that now there's more and more conversation where people are looking at, well, I don't just want to take pills forever. What can I do to really get rid of that or minimize that a little bit more? And the whole focus can just be really on simple stuff, improving our quality of life. And I think that a lot of us just a lot of times listening to patients, that's why it's important to have that time with them and then just educating them is because what I grew up on of what's quote unquote healthy turns out may not be as healthy as we thought, back then. So I think educating patients, because that's just a new way of thinking.
Yeah.
Really,
Yeah, and that's how you're gonna impact change, right? You get one patient in the door, you're able to educate them clearly, and then they talk to their whole family, right? Their family's like, "Wow, you have more energy, you're losing weight. What are you doing? Are you on some diet?" And they're like, "No, I'm just learning about my own health. I got these labs taken and here are my results, and so here's the therapies that we're doing." And they're like, "Well, where'd you go do that?" Right? And then it points right back to you guys.
yeah. Well, I've always tried to do things a little bit different. I don't love just either not doing something because nobody else has done it or doing the same thing that's always been done. And so, I try to push it a little bit. And to your point of what you're saying, we have out here in Amarillo, there is a nuclear facility called Pantex out here. And Pantex employees who've been exposed to certain chemicals and have certain health conditions have what's called a white card. And through
Yep.
the Department of Labor, it's paid for.
Yep.
And we have a contract with the Department of Labor where we take care of these patients. Well, what we've started doing that's completely different than even anywhere else in the country is that we've started looking at what are things that we can get DOL to cover that are medically beneficial and help improve quality of life. So we're getting things like hydration and vitamins covered, NAD, some of these therapies that have not traditionally been done with this population. And what we're seeing is tremendous of how much better these people are feeling. And it's been a success to where people are calling their home health agencies that they're working with and asking to come to our place because they've heard about these other therapies that we're able to get covered. And it's just been exciting to see because now some of these patients, their quality of life is better because of the simple things that we're doing. We're not reinventing the wheel by any means. We're just
Right.
introducing basic, type of therapies and things like NAD that are becoming more and more popular stuff that just helps us feel better in general.
It's most of it's like, hey, you're deficient in this, so let's add it in, right? It's something as it could be as simple as that. Yeah. And I mean, are you getting good response from like the Department of Labor and other kind of entities in that sense?
Yeah, so we're actually looking at opening clinics up in Las Vegas and Tennessee because those are two other large sites
Because
where
of
these
that, yeah.
things are. And so we're going to be rolling out in Vegas after the first of the year where we're specifically taking care of that DOL population because of the positive impact that we've had on those patients and obviously through that, then the Department of Labor home health agencies have been excited to work with us as well.
That's really cool. I love to see that, you know, a dream that started, 15 or so years ago came to fruition 9 years ago, but you're able to see like, wow, this actually has a foothold. Like we're gaining actually traction now. Is that what it feels like?
Yeah, absolutely. And, one other program that we created of thinking outside the box, but yet simple is about 6 years ago, we created a IV hydration program where we went into nursing home facilities and
Mm,
we hydrated residents for wounds, UTIs, malnutrition. But we did this on a consistent level where we went once a month and we actually created an entire program that I since have sold that side of the business off. But whenever we merged with another company on that side, we helped roll it out to 7 different states. And so now that program is just part of the quality measures and a part of just the entire way that the building acts and does things different because of that program. So it's really cool to see things like that implemented in that's just a part of normal day stuff now that 7 years ago you had to get sent to a hospital and an IV all for a UTI. Now a lot of these facilities are taking that proactive approach to where they're not having to ship them out, so it's better on the resident, it's not as stressful family, it's not as stressful, quality measures are better for the facilities, so it's a high five for them from the state. And so those type of simple things are just really fun to watch change
yeah.
just from simple opening your mind a little bit more and taking a different thought process has been really exciting of some of these things that we've done.
Super cool. I mean, it's kind of like seeing your kid grow up in a sense.
Exactly. That's a great analogy for sure.
Well, I have a 6 month old, so I'm like seeing
Okay.
changes every day.
Right, right. Absolutely. Absolutely.
But give me some of the insight. So I'm going to backtrack a little bit to what we talked about earlier. So, initially you opened up this clinic and it was just like, Let's see how this goes. We're going to offer like an initial kind of fluid therapy and maybe some vitamin supplementation. What other things and other therapies did you see that kind of kept progressing and you kept adding on to see better benefits for your patients? And like, what did patients respond well to in their recovery and in their health?
So, it's been, I would say, well, we started off as just a concierge company. So
Okay.
the
Okay.
first 2.5 years of business, we didn't have a quote unquote clinic. Our nurses only went out to businesses and homes and all those things. And I did that because once again, 10 years ago, IV vitamins were not near as popular as they were to, or as they are today. So we had to really educate. But I would say once we made the decision to open up a clinic, one of the first things that I invested in was a cryo. That was a hot thing 7, 8 years ago. Now it's become cold plunges and all that. But we invested in cryotherapy. And then we brought on our first mid level where we really started to dive into functional medicine because that was still a word that was still a little bit not sure what does that mean whenever we're talking about 6, 7 years ago. We brought on a mid-level where we started to more let's start looking at things like micronutrient panels where that's a blood test where we can tell every deficiency in your body from a vitamin and mineral state. So we started customizing plans once again around IV vitamins. And then we've just continued to progress
Yeah.
with different testing. Ketamine infusions is a huge part of my passion
Wow.
myself. 5 years ago, we implemented ketamine into the clinic, and that to me is one of the most misunderstood therapies out there because it has a bad rap, obviously, from being a street drug and how it's misused. But ketamine is a lot like anything else. If you abuse it, then it can be addictive and, catastrophic and all that. But if you do it in a therapeutic sense from being in a clinic and they're doing it proper ways, the things that we've seen transform through ketamine protocols and through patients has just been pretty life changing across the board. My experience with ketamine, 20 years ago, I found my uncle murdered on his couch. I went through all the traditional things of I did counseling, I did
Yeah.
antidepressants, I did alcohol, I did all the things.
Yeah.
And when we decided to bring ketamine into the clinic, I obviously did it. And I just kind of put ketamine to the test and said, okay,
Let's see what
here's
you
what I
got.
am. And I was able to process that trauma in a whole different way. 6 years ago, I wouldn't have been able to even tell you about my uncle because I just would never deal with it. I wouldn't talk about it.
Wow.
I just wouldn't. And so I've been able to work through it in a whole separate way. In fact, 2 weeks ago, I went and sat down face to face with the guy who killed my uncle out of prison. And, I attribute 90% of that to ketamine because without that, I would never have been able to process it and then continue doing kind of the work to get to a point to where I could sit down with that guy and, kind of ultimately end up forgiving him and being able to move forward.
That's
I think
incredible.
ketamine is just so misunderstood. And I hope that becomes a little bit more mainstream and
Yeah, it's very niche right now.
yes,
I
sir.
would say
Yeah.
you hear about a clinic here and there, but it's not very well understood from the general population. So the few who do understand only market kind of probably this much, you know? I mean, they really don't market a whole lot. And, here you are as a survivor of trauma and able to come out on the other side and look back and say, hey, this actually helps. Like, we should talk about it more, you know? And I'm sure you hear a lot of good things from patients too.
Right. I mean, we've had everything from police officers that have saved marriages to, you know, sexual trauma victims that have been able to work through it. I mean, just a little bit of everything. And, to the point of trying to push it a little bit different, I'm currently going through a painstaking process of trying to work with the local police department, of
Mm,
having some of their officers put into a ketamine protocol quickly after either, a police involved shooting or, the traffic cops see these horrific accidents and
yeah,
they see. So we're going through the process of kind of education and getting signed off on that because my hope is we can also make things like ketamine that is properly done and used properly and all that, where it becomes more of a tool instead of just having to deal with this trauma and shove it down to where then most police officers end up diabetics, alcoholics. They quit way
yep,
before they should because of the
yep, the
trauma, all this.
burnout.
So to me, being able to just loop in first responders and utilize this tool is something that I think is very interesting to me of does it really work? I mean, we've seen it work on a small basis, but until we take it on a real big scale, I think it's just interesting to sit out there and the VA's doing some studies with our veterans that I think is going to be really interesting coming out over the
Might be
next year.
groundbreaking.
Yeah. I think the future of those type of things is exciting because once again, people are getting tired of just the same old antidepressants and all the things that we're used to taking. So I think it's exciting of what the future is of how we potentially can deal with stress and trauma in a different.
Totally. Sounding, I mean, to be honest, like from a medical background, I mean, I wasn't trained on microtherapeutic ketamine to help with trauma, right? What we're trained on in the medical field is SSRIs, SNRIs, go to therapy, and that's your solution. kind of the buck stops there. And then you start obviously getting into like schizophrenia and all these other mental health kind of diseases, and there's specific treatments for those that medications have been developed over 30, 40, 50 years ago. Lithium for all these guys, methylphenidate for all the ADHD, and these different medicines that work under clinical trials. But have we actually utilized, like, researched enough the different medications that we've already developed to see if they could have other opportunities to work? You could say the similar stuff about psilocybin or THC, for different disease processes and mental health. But again, it all comes back to there's a stigma. And so it's how do we break that stigma or even approach just the education behind it, right?
And we've got to, I feel like we've got to change, even to your point about schizophrenia, bipolar, some of these people, whenever they're institutionalized, even,
Mm-hmm.
we know that sugar is bad for, processed foods and sugar in an unbalanced diet and their gut health and all these things. We know that that sometimes makes those symptoms worse or makes the patient worse. But yet, if you go to a facility where somebody's checked in under the diagnoses that we've talked about, they give them stuff like lemonade and orange juice and it's
Yeah.
processed honey buns. I
Yep.
mean, so to me, we've got to start shifting how we take care of people who are in those unfortunate diagnoses that just them alone have got to be in a fight or flight constantly because of how they feel internally. But instead of us doing simple things like giving them healthier foods, we're only making it worse while we're throwing more and more medicine at them. So that's where I get frustrated with. I hope I hope somebody higher up than you and I start making big decisions on how we should treat some of these people, even when they're institutionalized, but then even afterwards, educating them on how important a good diet is because of how our gut controls so much of our body.
Yeah. I mean, that's a whole nother stone that we have kind of left unturned up to this point. If we want to go into details about gut health, that's another hour.
Yeah, absolutely. And that's another part of what we do at the Wellness Center
Oh,
is
okay.
gut testing
The microbiome and that kind of thing.
because we understand that that is so important. And even honestly, I've been very fortunate to work around a lot of people that are way smarter than I am, that I've been educated all throughout the years. And so within the last 4 years, honestly, is where I learned how important
Mm,
gut health was. Because even though I have this disease that causes me, I have ulcerative colitis that goes hand in hand
mm,
with liver diseases. I understood kind of healthy eating, but I really didn't understand the importance of gut health, true gut health, until I was able to meet our nutritionist at the time, and she just educated me, and now that's been more and more of a conversation, and so our practitioners are now educated in a different way on gut health, and we do some of these additional tests to be able to really hone on health to then sometimes fix other problems.
yeah. I mean, other things can be fixed if that you didn't expect for them to be the downstream effect of a certain, there's an imbalance way up here, and some issue may get resolved if you just fix this upstream effect, right? But
Yes, sir.
a lot of times we don't know it because honestly, like in the medical world and in the medical pathway, med school, PA school, nursing school, you're not trained that way. you know I remember I did my capstone project actually on nutrition education in medical school. That was my
Yeah.
capstone project. And basically what I came back with, you get a lecture for a week, maybe a couple lectures for a week, and then thumbs up is given.
Right. Right. Yes, sir.
And that's kind of across the board, and so it's no wonder that I don't want to say that big pharma is the one driving the medical curriculum, but here are the medications to fix these disease processes, and that's the answer on the exams, right? Rather than let's look at the whole person and not the disease process,
Yes, sir.
right?
Don't just look at the symptoms. Let's look at what is causing the symptoms. Because I think that once again, the model that we live in is that a provider, you've got 15 minutes. So as a provider, what else are you supposed to do other than say, hey, here's a pill to help your symptom? Because you don't have the time to really dive in. Um,
Can't dig in, yeah.
yeah, you just can't dig in.
And I mean, we're extremely well. I had a previous podcast with Dr. Bourne, who's a naturopath MD in Washington State, and he made a really, really good point. In America and kind of the Western world overall, we are excellent at emergency care. We are top notch, top level emergency care. I mean, you're going to get the best wherever you go. But downstream, everything is lacking, right? The chronic care is there's this whole dearth of education and treatments. And, I'm just really encouraged listening to you and your kind of your journey up to this point of how you're approaching that and how you're trying to make those changes. Because you look at your website, you've got tons of therapies, so many things to offer. Is that right? Like
It is.
cryo, sauna, I mean, vitamins, IV fluids. Like, I mean, that's just the tip of the iceberg, is what I'm understanding.
Absolutely. On a website, I feel like you can put a bunch of services and all that stuff, but even people may not understand it. So that's once again ties back into coming down and sitting with our providers to really understand what are you really looking for? Because there can be, peptides are a huge conversation topic right now. And so I think just sitting down and really understanding all the therapies, because there are therapies, honestly, that we probably don't even have on our website, or I know we don't have on our website, but it can be overload of, even like you said, there's a ton of things on the website, but you don't want to put every single thing on there because then nobody's going to read an entire website this day and time. So we're just trying to, hit the highlights of what we do. And, we even do some aesthetic services. Honestly, that's not necessarily my passion. We
Somebody asked for it though, didn't they?
somebody asked for it. And mainly the somebody's our staff of
Okay, of
we
course.
started offering this. But we do some aesthetic services that, if you're feeling better, sometimes, you want to do some things to look better externally if you're feeling
Sure,
better
sure.
internally. So we do some of that, but honestly, that's not really where my passion is, and where even the drive of the clinics are. It's more in that, you know, functional medicine, and really
Yeah.
trying to dive into the person. And then on a lot of that external stuff, if they, want to go to other clinics for that, I completely understand as far as that, but hopefully they'll
No, but
they'll
I
continue to
hear
make
it. I
do it.
hear it. And my listeners will hear it too, that your engine, we know where your engine lies. And it's definitely trying to heal the person from within.
Absolutely.
So, we've already touched on kind of the journey up to this point, the different, obviously, it's an incredible range of things that you offer to help heal these people. How does I mean, and it sounds like the business is really growing. What are some of the big, I guess you can share some pros and cons of running this business and kind of what you've seen over the past few years, but the advances that you see that are coming maybe more quickly than you realized, different innovations and growth tactics that you're kind of taking, or roadblocks that you're seeing that you don't quite have figured out at this point. That's a big question. So break it
Absolutely.
down as best you can.
So I think, roadblock, I use it more as hurdles. I don't ever like to look at a roadblock because I just want to jump over the top of it anyway. So I look at, so I would say the biggest hurdle that we've had is just getting um, people to think outside the insurance box. That is something daily that we have to educate people on, and even sometimes have to do the math with them of, if your deductible is $7,500, and even if we did take insurance, how many visits it's going to take. And so I think I would say that is our biggest hurdle, as far as getting people to,
Into the
think
patients
outside
themselves.
that. And then I think the other hurdle is that, from an IV side of things, you can throw a rock and hit 12 places that do IVs now. That is concerning all in itself, because I think that you have some people out there doing it that aren't going through the proper protocols and the oversight and some of those things that I think is a little bit dangerous. So that's definitely a hurdle, because now, even as a customer, you're not sure which way to go, because this place is advertising IV for super cheap. So that makes it seem like, well, I want to go over there. But sometimes cheaper is not better. And so I think that that's a hurdle that as you create more and more competition's great, but is it always safe competition? Because I'm all for some competition. I think that makes everybody better.
Yeah.
Um,
But
I
what's
think
the
I think
regulations?
regulations on it. So I would say those are the two biggest hurdles because it's hard in this day and time with social media to capture somebody's attention in 3 seconds, and really educate them on a functional medicine clinic.
Yeah.
Like I said, we've been very fortunate that big people are having more and more conversations around the idea of functional medicine and not just traditional medicine. So that's definitely helped for sure.
Right. Right. Yeah, what are some of the big obviously we talked about some hurdles, but what are some of the big victories other than, the contract with the Department of Labor? I mean, what are you seeing good growth even in these kind of West Texas communities, like the word of mouth that's being passed around?
Say honestly, the past couple years have been slow just because I think the economy in general was a little bit, weak. And so I think that
Mhm.
whenever you market to an expendable income crowd that's just cash pay, some of those things can be a little harder to get people in the door. And for us, we have been known for IVs for so long because we started off as an IV company. We were the first ones in West Texas to do it in kind of that concierge. So we have been educating people of think of us for more than just IVs. And so we're definitely on an uptick for sure this year. I would say the last couple of years were as the business owner, they're never as busy as you want it. But, we've been fortunate overall to continue to grow. The last couple of years have been a big learning curve, I think, even for me, when I sold off our nursing home side of things. Honestly, it was the worst business decision I ever made. I thought it was going to be something great that just turned out not to be what I thought it was going to be. And so
Yeah,
there's some hell, I could do a whole hour podcast with you of what I've learned over the last 2 years, but,
sure.
I think we're fortunate enough that we went through a lull, but we are, back on the uptick and just exciting for the corporate wellness programs that we're building out and, conversations with the police department about some of the things
Yeah,
we're working with them. So I'm excited about just the new ways that we're pushing the envelope a little bit, not just the traditional boring way.
totally. And I think even talking with recently, I talked to a direct primary care doctor, which is kind of that subscription almost model.
Mhm.
And they talk about making contracts with big businesses, 10,000 employees or something like that. And they say, we could offer you insurance, or we could just hire you guys as on a contract and hire your clinic as to be the place to go to. Right.
Yeah, absolutely.
And yeah, if you go to this clinic, we cover everything there. And, I mean, that's a win win in my
And I
understanding.
think, part of what we're presenting kind of in that same model is customizing what does that look like? Because, for a construction company, we might talk about providing IVs whenever the outside temperature is above 100 to help reduce heat stroke and
Hmm.
dehydration.
Hmm.
And for a bank, it could be that we're talking about monthly vitamin D injections I mean, so for us, we have once again trying to just take that customized approach for each business.
Yeah.
But because in the long run, it sometimes takes a long run for the employers. But if you're doing some of these proactive things, most of the time you're seeing that employees are not as sick as much,
You're
the
not having to pay as
retention's
much.
better because you're investing in the person and they're feeling better overall. It's just sometimes getting that initial buy-in
Yeah.
to think
And it's tough
outside.
if you don't have something to pull off of and somebody is the guinea pig per se, you know? Are you having a good I mean, do you have a pipeline kind of set up at this point? This may be, too high level or too specific, but do you have a pipeline of businesses that you're kind of talking with or kind of developing those relationships with so far?
Yeah, we've been fortunate of that. Even some of our clients are business owners and HR people, and so we have access to some of these conversations. But I would say yes, we've been fortunate enough to be having conversations, and I think even with the current administration of some of the changes that they're even looking into, I think that has also helped other people open their mind of "Hey, maybe we should look at doing things a little bit different or, open our eyes." So that has definitely helped conversations continue to progress.
Definitely. Definitely. Well, as we kind of wrap up, we're kind of hitting that time period, but what are some kind of closing thoughts? I mean, highlight yourself, highlight your business. Where can people find you? Kind of the 10,000-foot view to kind of put yourself out there.
Absolutely. No, I appreciate it. So, for the business, our website is going to be ivrstx.com. And then, of course, social media, we're on all platforms as far as that goes. I personally, probably LinkedIn is the best way to find me, just James Marlin. And, I would just, my closing thoughts, I guess, would just be to invest in your health like you've always invested in your wealth. I think that that's just so important. That way, as you get older, you're able to still be young and spry and, enjoy the money that you worked your butt off all your life. That would be just kind of my closing thoughts to leave it with.
I think that's a perfect bite for the whole episode. Probably is invest in your health just like your wealth,
Yes,
or at
sir.
the same level.
Yeah.
Well, James, thanks for your time, man. Really, really appreciate you joining the crew and really just having a great conversation about your business. And I hope it continues to grow. I mean, you got a big, Q4 kind of leading into Q1 is going to be a big jump off point for you guys, I hope. And I hope it just continues to kind of catch momentum from there.
Well, I appreciate you having me on.
Absolutely.
All
Take it
right.
easy, man.
Thanks, man.